Hello there, everyone. This is Through a Therapist's Eyes. You have found the YouTube live version on Thursday nights. We get together before we turn the mics on at about 6:15 or 6:30 whenever our sessions end. Is that right, John?
That's right. I just had one in.
Yep, you just had one end and he scurried in to do the show.
And then I got yelled at.
He is yelling, actually, even now, I imagine, before the live mics go on for Spotify. He might get on to you about putting your head in the right position.
I need to eat the mic.
we're getting on John for his microphone management skills. Is that what it is, Neil? Microphone management skills.
I'm a bobblehead.
No, we said you're a slouch.
I'm a slouch.
And what am I?
You're skitty.
No, that's what's her name?
You're squirmy.
I'm the squirmy.
I'm slouchy. You're
She's skittish.
Yeah.
Victoria is. Anyway, you see us. This is obviously before we go live with what you hear on Spotify. We're talking about schizophrenia today. And it's just a diagnostic show. We haven't done just a basic diagnostic show in a little while. And so hopefully she gets to jump on. I have a student that is training with me, I guess, at this point. She's, well, you've met her, John, the nurse practitioner, right? She chose this diagnosis. So, I gotta turn this down. Yeah, she's with us, and she chose she was going dissociative identity, and then she was going to personality disorders, and I was like, so she landed on schizophrenia.
Oh, good.
This is her choice. So hopefully, LaDonna, you get to jump on here and say hello to us. She's working, though. She wasn't sure if she can make it.
Well, LaDonna, I look forward to your feedback
Right?
and participation.
Did you have a good day, man?
Yeah, a very busy day.
You've been busy today, haven't you?
Definitely.
Mm-hmm.
So if I start to be scatterbrained,
We'll pull you back in charge.
pull me back.
Pull you back in line.
Yeah.
Okay. So, Neil, I'm supposed to pause and delay and let you type and do your thing, but are we ready? Oh, yes. His mic is off. We got issues.
Is there another mic?
Uh-oh. Fill the space. We are behind the scenes mic problems. Actually, that happened before at one point.
Yeah, there was a cable issue.
And then it went away. Yeah, we got cable issue, now mic issue.
Okay, I'm going to try it now. And,
Check, 10-4.
check, check. Hope all is well. And to all the ships at sea. And now, hello, America, and all the ships at sea. I hope things are going well.
Was it
Might be a cable issue. These older cables. That's what happened the last one. The cable
Yes, it was.
stopped working.
So I'm intrigued by the microphone deal.
Yeah.
I guess I should be talking and saying
Well, no,
hello
I-
on YouTube.
No, this is fine.
Mm-hmm.
This is good.
Cable issue.
Yeah.
The cable is dead. That is not good. And do we have another one for your mic later on?
We have a shorter one. I can try.
Okay.
We have repaired. We have recovered.
Episode 235.
That's right.
That's right.
You know, we got to get you to do the intro. You want to do the intro today on the live show?
Oh, no,
You wanna-
that's fine.
Come on, you can do it. It'll be great. It'll be a switch up. He bails.
I'm going to bail.
He
Yeah.
bails on the idea. Got it.
I'm still, I as a preacher, I preach every Sunday.
Right?
Okay. Yeah. But I still get butterflies.
Really, when you preach?
Yeah, when I preach.
I
When I
think
used to
that's-
do theater, I used to
Yeah.
still get butterflies. Never get over that
Yeah.
completely. Yeah.
I think that's because, I asked an interesting question. So you're going to be working, Neil? 10-4, tech,
Yeah,
tech?
it
Yeah.
looks like I'm good. Yeah, I'm good.
Okay. So, I was asking a colleague of mine about that. I was like, I was playing just softball at the time. I'm like, I go in there, I'm kind of like worked up. He's like, I'm like, is that normal? What did he think? And he was kind of into sports psychology and stuff. And he confirmed, he's like, well, and he made an excellent point. Like, you wouldn't want to go into a presentation dead, would you?
No.
Like you want to have some energy, you want to have some angst with
You
it.
are.
You want to, I mean, it's
The-
charge.
The problem is, and I think one of the things that I've done with my students when they were starting to psych themselves out for taking standardized tests, for example, the
right.
National Counselor's Examination, NCE, is that they got so anxious that they lost their efficiency or their ability to.
Oh yeah, you
to
get
think.
discombobulated.
Discombobulated.
Disjointed.
So you have to have just enough.
Oh yeah, yeah. You want to be under control.
You don't want to
and-
psych yourself out, but you at the same time you want to psych yourself up.
I think you're right. I would psych myself out with band. Like, dude, I couldn't do solos.
Uh-huh.
I couldn't do a trumpet solo to save my life. I freaked out. I don't know what it was. Like I was just bad anxiety and playing at that point in life. And I think I'd probably still have it now. I don't know. I'd be curious, but like I know a lot of musicians have anxiety, and you do get it is that precarious psyched out versus getting jacked up for it.
Well, I think
Exactly.
it also goes back to if it's something you're excited about or you're invested in, you're gonna have more anxiety. If you just didn't care, you talk about being dead, you're not gonna put it
Flat,
out there.
yeah.
So because you care, you get a little bit those butterflies in your stomach because you want to do right.
When I married the lovely Mrs. Pope, when her name was Miss Rowe at the time, when I married her, and Ernie Gilmore, the minister, said, "And do you take this woman to be your wife in sickness and in health, in richer for poor, and all of that?" I said, "I do." And it sounded like John Wayne.
Okay.
Yeah, I was like really freaked out.
Like
So-
I think I do.
I do. I did. I meant it with all my heart, but
The way it came out.
it came out. Yeah.
Well, that'll make you shaky. That'll make you shaky in the knees for sure.
Yeah.
Those moments.
And I locked my knees.
I
That
don't
was
even
a
hardly
mistake.
remember. I was just like there.
Oh, yeah, my wife remembers everything. They do. Yes.
Ready to roll when you are. Hello, you have found Through a Therapist's Eyes. This is episode 235 on July the 6th, actually, already. We keep moving right through this year, man. July the 6th.
Over halfway through.
It is already halfway through 2023. Nuts. Mr. John Pope hanging out with us over there. How are you, sir?
I am doing outstanding.
Had a
Thank
busy
you.
week, huh?
Busy
Or busy
week.
day,
You
actually.
like? Yeah.
You said busy week or busy day? You could-
Busy week and busy day.
Well, we were both here on July 4th.
That's right.
We both worked on the 4th.
That's
okay?
right.
You have had a busy week. Through a Therapist's Eyes, we are going to be talking about schizophrenia today. Listen to these questions. Do you know what schizophrenia really is? That's something that I wonder and think, I suspect, a lot of people really don't know what that even kind of is. And then do you realize why this is within, normally your own world, your own neighborhood, your own circles? Like you do find, we'll kind of talk about how common this is, even though it only affects 1% of our population. It's not something that's just obscure and doesn't happen. And then what is it really like? What is a life with schizophrenia really like? So again, this is Through a Therapist's Eyes. We are live on Thursdays on YouTube Live. Check us out on that. I think you'll enjoy interacting with us there. Contact also at throughatherapisteyes.com is a good way to email us to get interaction. We like that. We have the panel. Victoria hasn't been with us for like a month, actually.
That's right.
Where has she been hiding?
You come back, Victoria.
Right? Where are you at, girl? Of course, we had guests and we had different scheduling weirdnesses, and and then she had a childcare thing. I don't know. I swear, guys, she's around. She'll be back next week. 5 stars on Apple Review. Tell all your friends. Help us grow the show. We want your help in 2023. So, the human emotional experience is what we endeavor to figure out together. That's what we're about. So, what do you think about this topic, man? Schizophrenia.
And we're not providing any.
Oh, we don't provide therapy services of any kind as well, even though you get information directly from a panel of therapists in your own home.
I'm very excited about this topic.
Are you really?
I'm of a split mind about it.
Why? How so?
No,
What do you
I'm
mean?
joking. That was
Dissociative disorder
that's
joke.
Joke. Yeah. No, I'm excited about it because even though it's not pervasive, it's significant. I think in terms of I think we may all know someone that has this condition.
Yeah, that's the thing. You know, I was let's go there for a moment because I spent a little bit of time on it in the intro. You know, with the question that I had. How did I pose the question? Do you realize this is within your own neighborhood, your own circles? Like, I literally had just somebody today that I met as a new client, and she told me that I could say this. So hey there, I hope you're with us. By the way, no, she has a family member in her own circle that had schizophrenia. And I was like, wow, like how ironic is that? I'm talking to a new client and I have this topic, and part of what I wanted to do is to kind of take away the myth, the weirdness that people have. Like, who has schizophrenia? Like, does this ever happen? This is a weird thing, and you know that's the crazy people, isn't it? And it's like, that's not it at all.
That's right, and I think media, in our movies and in our culture, we have some misconceptions, and we carry that in terms of an understanding. I think we have a misunderstanding.
We have a misunderstanding of what this is for sure, and so we want to blow that up a little bit. We actually did a show on schizophrenia a long time ago. Yeah, it's been a few years ago. So she picked the topic. I didn't pick the topic I wanted to do.
Well, good on LaDonna.
Right? Good on LaDonna, because it's something that it will get lost, like it doesn't get talked about a lot. So I also have a family member in my own family we believe had some sort of psychotic disorder. And I think before the mics came on, did you say that you did as well? Or
Yes. Yes, I did. But that person is long past.
Right.
So.
And so is my Aunt Mary. You know, it's just amazing to me that this affects about 1.5% of our population. But that 1.5% represents how many people would you think in the United States?
Well, it's over 3 million people, right?
Yeah, no, like 35 million if I got the numbers right. Where is that? Oh, no, you're right, 3.2.
3.2. Okay. So it's the size of Houston.
Yeah. Yeah.
Texas. Okay. That's a lot of people.
It's a lot of people.
Yeah.
It's a lot of people. 3 million folks have this type thing, but 1% is kind of more on the rare side. And I honestly wonder if it is quite that rare. You know, maybe we'll get to talking a little bit about that.
Well, I suspect it might be a little more than that, and I think I think we'll get into that.
Yeah, I have a sneaking suspicion that there's a little bit more that we don't realize happens. That is we just have kind of a lack of identification, given that you know. People feel like this is one flew over the cuckoo's nest. This is something that we'll get into it. So broadly, John, I'm just kind of curious. I was even wondering, like, in our field, we see a lot of this in inpatient facilities for sure.
Right.
You know, in the mental health system that I worked in, you know, we had some of this early on in my career. And then we got away from that with the way that mental health care is delivered, at least in the States, the way this is. But if you don't work in a crisis facility or a rehab center or whatnot, you might not come across it as much working in mental health. So I am very curious, in your well-traveled experiences, like you've been doing this for a minute, and I think I know most of your experiences and stuff, but I am literally not sure if you've ever had a schizophrenic patient or not.
Yes.
Okay.
I have. And it was before I was trained formally in terms, in
pastoral?
I was a Navy chaplain, and I was assigned to the psychiatric ward of the Naval Hospital in Jacksonville, Florida.
So that's enlisted people.
Yeah, enlisted people, yeah, officers. But in this case, it was actually he was a newly minted seaman.
No kidding.
Yeah, just a recruit, and he had
Well, okay.
and he had just he started becoming delusional. He started becoming paranoid. He was diagnosed and was placed on the ward, and he actually had a job at for his temporary duty.
Yeah.
He was basically inpatient, outpatient, worked at the hospital, and I worked.
He actually
with him.
worked at the hospital?
Yeah, well, that it's interesting. This was back 35 years ago.
Yeah.
And so he was given a job, and he was able to do some minimal amount of work, but he found it had so much medication that it was very difficult for him to concentrate. at
Oh,
the
so you're
time.
saying he was diagnosed and then
He
put
was
in
diagnosed
a mental
and
hospital
and treated.
and treated and
Yeah.
then given a job.
Given a
Well,
job, but
kept
he was
him
still-
enlisted?
Yes,
Diagnosed schizophrenia, kept him as enlisted.
until he got better.
That
See,
is
that's the
shocking.
thing is back in the day,
Wow.
they would keep people that with HIV, for example. That was during the heyday of, unfortunately, of AIDS.
Really?
And so the Navy would not let people leave the service until after they made sure that their health was taken care of, those issues were taken care of. And so a person would be, for example, with HIV, would go into full-blown AIDS. They would treat them and not medically retire them until the last moment.
Till they were better or
to a better
terminal.
or worse. Terminal, yeah.
No kidding.
Yeah.
That is not the way we do now.
No.
That has changed. Interesting. Yeah, it's interesting. My surprise was such that, how would we have an enlisted member of the military have such a significant, because this is a serious issue. Schizophrenia is not a simple mental health issue. It's not like, it's a heavy diagnosis, a biological reality that your body is really struggling in some very
And that's the
specific
other
ways.
thing. I think, I'm sorry.
No, go ahead.
Well, there's an organic aspect of this, and they could do brain imaging and MRIs and CT scans, and we'll see the differences in the brain structure as a result of someone having schizophrenia.
Correct. Well, to get back to my thought real quick, and then we'll go there with maybe
I
it's a
didn't mean
good
to jump.
transition
Yeah.
into what this is, right? So, at first, when I was listening to you talk about an enlisted service member, I was kind of surprised in that how would we have somebody with a significant syndrome or issue diagnosis like this? But then it occurs to me, well, because you're enlisted, you train and you begin to serve, and then it begins to manifest.
Well, and
Right?
he was 19.
Right. And this is about the time that it begins to manifest.
Yes, exactly.
17, 18, 20, 22, in that early life time frame, this is when you're perfectly fine, normal thought process, normal cognition, normal sensory experience, and then boom, this starts to come out, and your brain starts like being very, very different with reality testing and the various things that we see with this. So, yeah, in the military, treating them while he's enlisted at that time of manifestation is really pretty cool.
And then I also had someone in my congregation that was
Okay.
she actually had two overall, but
Really?
I've been a minister for 44 years. So,
Yeah.
I mean, I've seen a lot
Yeah.
in terms of that. And they were both women. One was a young woman. It was about my age at the time, and she had this. She was very prim and proper, and suddenly, within a period of 6 months to a year, she had developed. She became promiscuous. She was hearing voices. She was reacting. They kind of ruled out bipolar eventually, and she had to be institutionalized for a few years. And she had this awakening that said, "I can't. I'm hearing these voices. I want to act on them. I'm not going to." And,
Right.
Yeah. And
Yeah, it's funny. I just flipped through and I was listening to you tell that story of what you experienced with this coming out, and I start flashing back to these different folks that I've worked with. One, I forgot about him. He was a teenager, and we end up identifying, I think accurately, schizoaffective disorder, which is actually a combination of bipolar and what we're talking about today, schizophrenia, which is a pretty hard thing for
Yeah.
a teenager to start experiencing. Can you imagine?
oh yeah.
I mean, that's what we'll get to when we talk about like what is life really like. Like we'll get into that. Like this. Can you just imagine reality testing? Meaning you don't know if what you're feeling on your skin is real or not. You don't know what you're seeing in
Are these
the
bugs?
room is real
Yeah.
or not. You don't know. Because there's olfactory. What you're smelling, is that real or not? And of course, hearing.
And the
That's
hearing is the most
amazing.
common
Auditory hallucination.
auditory. Yeah.
Yeah. So what is this, John? What is schizophrenia? How would you be able to go at the definition
I'm gonna
without
look at
the
it.
prep cheating? You can
Okay.
cheat. You
All
can
right,
cheat.
now,
Go with
you got-
what you do.
It can be. It can be positive symptoms, and by positive, it's not positive. It would be manifested, such as hallucinations, visual, audio, usually auditory hallucinations, olfactory hallucinations. It would be a sense of disorganized thinking, speech,
Right.
word salad. Basically, when it would be tangential. It would be hard to follow a person's conversation. That would be manifesting signs and symptoms of schizophrenia. There could be an overreaction of emotions, or it could be a negative
Symptoms.
symptoms,
Negative
which would
symptoms,
be
okay.
flat affect,
Right.
for example. There might be a sense of a withdrawal and not having contact with interaction with people. So there's almost
Good stuff. You know
yeah.
your stuff, man. Banging. Impressive, Mr. Pope. And I can tell you, you look on the YouTube live, he is not reading, and he's
It's
going
not.
cold. You did really well with that. Do you remember the different types of schizophrenia? What were they? Disorganized, catatonic.
Yeah.
What are the other ones? I'm going to cheat.
So catatonic would be more the
Disorganized,
Yeah.
paranoid.
paranoid. And paranoid is very difficult because one of the things that happens is that there can actually be a violence as a result of a person having that paranoid ideation. It becomes homicidal ideation.
Yeah, well, they're protecting themselves.
Yeah.
They become
Yeah.
paranoid that the FBI is coming after them, and then they're going to
Yeah.
protect themselves.
Well,
Yeah, my Aunt Mary had a little bit of that paranoid variety.
Yeah.
For sure. I mean, I think it mixed all in
Well,
together.
and you get the idea of the person putting up. Let's say I knew somebody that put up aluminum foil. When you talk about tin foil, but aluminum foil up on the windows to make sure that nobody was going to
To protect themselves.
from the
Yeah.
CIA. And
You're
this
right.
person had her husband's ashes on the mantle, and she said, he talks to me all the time.
Yeah.
So it was,
It's a lot.
yeah. And other than that,
It's fun. And
she was nice to talk to.
go a little further with that.
Yeah.
What do you mean? Other than that, she
could cook, she could bake, she could drive and volunteer. This was at church, and she was, other than that area, she was fairly mundane.
and people would not think that way.
Uh-huh.
Listen, the case that I was thinking about was a college kid that I was working with in therapy. I do not recall what he came to a therapy session for, but it was just stress, just turmoil, and and various things like that, right? And so, I started working with him, and it was like, he was fine. We had normal conversations talking about stress and worry and his how to manage the way he was feeling, and I was kind of younger clinician kind of as well. This is a while ago, And
So he could relate to you.
he could relate to us. We were probably not too far out of college. Well, let me see. When was this? It doesn't matter, but I'm curious. Yeah, I mean, I was about 5-6 years out of grad school, so when I had started to do therapy,
So you were late 20s.
I was late 20s, early 30s, maybe.
Yeah.
Anyway, so he appeared normal, John.
Uh-huh.
I didn't know what was going on, but it had some oddity to him, and there was some of that disorganized thinking that was starting to manifest, or that was a part of his presentation. But then, as we began to deal with a specific problem that he was having with his academic career, he was upset with a particular professor, and I stumbled upon this entire delusional, wholly created and became clear to me fabricated reality about this professor. And he brought in a videotape and a box of matches and a note. And I actually kept this because I was so stunned at, like, wow, this I diagnosed and figured out this psychotic delusional state that this seemingly otherwise normal looking and sounding guy was struggling with. And it was bizarre. And then from that, we began to kind of identify a little bit of the more reality that he was dealing with his family and some of the otherwise disorganized thought that he had. And there were some things that I think I had missed. But yeah, man, it connected things that were not connectable in his relationship with this professor in a delusional way. I mean, he was full-blown psychotic, and I didn't know it. That was my main point with that case. It's not exactly obvious, some of these symptoms.
No, it's not, because they can present, let's say, in many areas as absolutely
Fully functioning.
functioning, baseline, normal,
Yeah.
but not.
Yeah, but these things are absolutely a part of it. So interesting. Functioning on a fundamental level decreases, though, as things progress. These signs with hallucinations, and that you were talking about with the positive and negative, are there for about 6 months at least. Manifest in late teens to the mid 30s. So this could be anywhere in your 20s that this begins to pop out. Normal until it pops out, and then it pops out. It's like, there's not. Some people, sort of rare though, can recover completely, which is interesting.
Yeah.
And then the psychotic symptoms do diminish over the course of a life cycle. And I'll tell you, I was just listening to our podcast, Skeptics God of the Universe, John. And they were talking about this, the schizophrenic reality because of tumor that they found.
That's right.
Do you remember this show?
Charles Whitman was the shooter in Austin at
Yeah.
the University of Texas, and he had a tumor basically when they did the autopsy of him,
Right.
after he had died, but he had killed a bunch of people.
Yeah.
But that's a result of tumor affecting making one schizophrenic.
Well, making one schizophrenic. That's what was interesting to me to hear. Now, he's a neurologist. He doesn't specialize in the mental health diagnostics. Kara supposedly does.
Kara Santa Maria, but
Yeah,
she's got an agenda.
well, there's that. But hey, Kara, come on the show. We'll talk to you. It'll be really cool. But anyway, what I was really thinking a lot there is
I was teasing.
Yeah, I know you are. We love them all. Syndromes
Mm-hmm.
instead of diseases is what he's kind of maintaining, because a lot of the mental health conditions are in diagnostics of exclusion of other medical realities. Now,
Right.
I don't know how I feel about that. I feel it's a little bit off. But he was talking about looking at the neurology and the brain imaging and the tumor reality and the different medical thyroid maybe that contributes to creating schizophrenic-like symptoms.
So he's talking about.
Did you see this show, or did
Yeah,
you
I did.
know what I'm talking about?
I did. Yeah, and I'm wondering if it's like a perfect storm of symptoms that come together, and
Well, I think that there can be a perfect storm with medical realities, yes. And with the people that I've worked with that have been carrying this diagnosis, There is no tumor. There is no medical. There is no workup that was done
Yeah.
that found anything significant. And this is the common set of symptom sets that were there.
Yeah.
And it's schizophrenia.
Yeah.
So I think he's a little biased in,
Yeah.
in the medical realm of
Uh-huh.
what medically creates schizophrenia, that it's only a syndrome otherwise.
Uh-huh.
I think that we just don't understand the mental health.
There was another idea of inflammation,
Right.
as
right.
being one of the causes,
Right.
or contributing causes of this.
And so the idea is you rule inflammation out, you rule tumors out, you rule, brain injury out, you rule other things out, and then because of the exclusion of these medical things, you can then say schizophrenia.
Yeah, yeah.
Which,
Okay, I got where you're going on that. Yeah.
right? How do you feel about that?
Well, far be it from me to.
Yeah.
I can't comment on the medical aspects of it, but I can comment on thinking that I think it is a real thing, and that it might be discrete from, let's say, having like Charles Whitman and having a tumor cause that. It has to be more than that, I think.
Yeah.
So I think there are plenty of people that if you did an imaging of the brain, you would see some structural differences, but that would be within the brain itself. So I think that maybe it's maybe there's something that's there. It's organic, genetic.
And it's interesting.
Something.
We have a YouTube live comment that talks about, can you have other mental health issues that hide schizophrenia, or can it be identified easily? And I think that's what we're talking about, right? There's this blending that does happen.
Yeah, yeah.
Go ahead.
You could have a lot of anxiety and
Right.
and have schizophrenia. You could also an aspect of depression. You could.
Well, those are
could do
part of the
that.
negative symptoms.
Negative symptoms, and so let's say you have a major mood disorder, and it's severe, and you would resemble in some cases a negative presentation of schizophrenia or catatonia.
So what is this really like? Let's hit into the idea that we've hit this as a little bit common, more than we would think. We've hit the idea of like kind of a little bit about what it is, and I love this dialogue that we just had about tumors and other medical things that blend in. What I wanted to dispel the belief that these people are crazy, and that they just act like fools or act nuts, like right?
There's no intentionality in it. Is that what you're saying?
I think so.
Yeah.
I think so. Go with that.
No, I don't think they're acting this way on purpose, or that they have. They're not all crazy. It's not craziness.
Yeah.
It's different.
Yeah.
It's,
I really kind of
I
feel
think
like
craziness is not a good definition for anything.
what does that even mean?
Yeah.
I really kind of feel like there's a little bit of like wow factor.
Yeah.
When if you can just imagine, like what I feel like I've been able to do really well throughout my career is put myself in people's shoes, to genuinely try to experience what they're experiencing. And I've done this with particularly that teenager that I worked with. I was able to kind of like get into his experience and the way that he described what he was talking about or what he was experiencing, and particularly being early on. And we had such a good rapport in therapy that he was willing to talk about what he really, really experienced. And I was able to like be like, wow, so here I am, like this guy. I'm going to call him John in honor of you, John.
Oh, thank you.
I'll say John was this teenager, and he's thinking fine. He's in school. He's interested in girls. Like he's doing all the things that you and I and we all know that are part of normal development as a young adult. And then he begins to have like these experiences that are just obscure, very random, and not very often, but just like I heard shit in the hallway out there, and I went out to check, and there was nothing there, but there was like I heard a voice, And then you just didn't even think about it, and you left it be, and you went along with your what life. But then you began to hear things, particularly
Intrusive.
at night, that are intrusive, and there's a directive thought that says, go get the dog and put him out, kill him. Like, I'm hearing this, and I don't know what to do with this, John. I don't know if it's real, if it's not. Can you even begin to imagine how much that would freak you out? Yeah, it's going to make you a little anxious. And yeah, when you begin
It'd
to
make
realize,
you scared too.
terrified.
Yeah.
There's something really, really, really wrong with me.
Mm-hmm.
And I think that that's what begins to happen as you begin to experience these odd sensory, auditory, visual, or olfactory, your textile. Those are feel, smell, hear, see. Those are your senses. This is a sensory issue where your mind is literally playing tricks on you.
Yeah.
If it were like able to understand, oh, it's not a big deal, your mind is just doing this and it's not real, and it wouldn't be much shame about it, or there wouldn't be much fear about it, I would think schizophrenia would be like not a big deal.
But there's
Can you
also
imagine
an
that?
aspect, but there's also that aspect, which is the urgency and the commands, directive nature of this.
Sometimes.
Sometimes. And that's got to be overwhelming.
Very much so. There is shame involved in it. There is embarrassment. There's terrified fear. There's these very real experiences that get elevated. And then, to one of our YouTube listeners was saying same thing. Some folks just don't think they have something is wrong with them. That's what she said, and you're right on, Cass, in the way that people are experiencing this in their real life as this develops. There's like, I'm not crazy. There's nothing wrong with me. I'm holding on to my sanity, but I have this experience. It's really weird. I don't understand it. It makes me fearful, and I don't want anybody to know it's happening, so I'm not going to let anybody know. But I'm okay. I can get along. I'm normal. Like, and you just go in and out of that, in and out of that, in.
Well,
and
and
out of
that's it's interesting because both with the young Navy seaman, he was actually from Montana of all places, but there was my church member, and she would struggle, and nighttime was the worst part of it, and would tell her to do things, and she had noticed herself having a personality changes, and, and she hated that, but then she also felt compelled to do many things that she normally would not. She'd become promiscuous at one level and one time, and she said, I have to do something about this. And so she started complying with medication.
Good.
And
Good.
she ended up being able to be a successful author and wrote children's books.
Well,
So-
it's a good segment, right? It's a good
Yeah.
segue to we've got on the show notes listed an article. So Neil's going to join us a little bit to kind of help us understand, like, there's a lot of successful people that have engaged in life, but yet have these sensory experiences that are full blown schizophrenia, and it's amazing to think about. So, like, is there hope with this? Like, you know what, there is, because if you get supported and you get to like recover, like, you know, my teenager that I was working with, I think I named him John. You know, John got very violent
name.
in school.
Good
It is a
name.
good name, right?
Yeah.
You like that name. But he got very violent in school because he was having a hard time dealing with his peers. He did have a hard time accepting and feeling comfortable with himself. And so, you know, he started acting out and getting in trouble. But we really got him calmed down and say, like, look, this is okay. We can manage this. We can treat this. We can engage with this. And you don't have to hide this like you were before. And I'm telling you, it was amazing to see him calm down and really get well. So people can be authors. People can be successful. Neil, who we got that was famous that had schizophrenia? I'm curious. I don't know how to tackle this list. There was a lot of people on the list.
Did you actually look at the list before you began? Or?
I did. I went about halfway, 3/4 down. Maybe you give us a name, John, if you recognize one of them, and I do. We'll look a little bit more in depth at what their deal was.
Yeah, so we'll just start going down the list. So Lionel Aldridge,
Don't know him. Do you?
No.
he was a football player.
Oh, okay.
Okay. Sid Barrett,
Sid Barrett. No.
he was one of the founding members of Pink Floyd.
Oh.
Yeah, I read that.
Yeah.
Okay.
Stay there for a second. How did he function? What was the?
Well, he basically left after the next frontman David Gilmour took over, and then he also had a lot of things with serious drug abuse, and he was never actually. There were reports he had it, but he never actually confirmed it. But then as he grew and went, he had a lot of issues with a lot of other health issues as well. So, but yeah, he was one that they never officially diagnosed him.
But
there
is
was a
suspicious,
lot of-
suspected
yeah.
that as such.
Yep.
Okay.
All right. So next one is Charles Buddy Bolden. He was you know that one. He was a jazz music pioneer. He was diagnosed at age
Artistic.
of 30.
Are we starting to see a little trend?
There's
there?
a couple of trends when we go through
Yeah.
this that you'll see some things. Yeah, he was a jazz musician diagnosed at 30. Edward Einstein.
That's Albert.
We know Einstein.
Yep, he got diagnosed at age 20.
This is his son, Albert Einstein's son. I was surprised when I saw this list, and I'm like, oh my gosh.
All right, then we got Zelda Fitzgerald.
Yes, that's she was. They were the Fitzgeralds. They were. He was an author, and she was. They were married, and she was a creative.
Did you know she
person.
had schizophrenia?
Yes.
Oh, you did know that?
Yes.
Impressive. Okay.
F. Scott Fitzgerald was the husband, and he had his issues and struggles with alcoholism.
Yeah, he wrote The Great Gatsby, with,
Right.
plus a bunch of other books. So,
Tender as the Night was another one.
all right, so Peter Green,
Peter Green. No.
yeah, guitarist and founder of Fleetwood Mac.
Fleetwood
Creative.
Mac, pretty
Oh my
pretty
goodness.
big band. Yeah.
He was diagnosed at 31. Daryl Hammond,
Daryl Hammond is
Supposedly, yeah.
Saturday Night Live.
comedian.
Yeah.
Yeah.
Yeah, that was
Hey,
a surprise to me.
Killer Clinton.
Yeah, oh, yeah, great.
Killer Clinton was a
Yeah.
skit he did.
No. I'm saying I'm an old guy. Okay, Killer Clinton he was an outstanding imitation.
That was his.
Oh, okay. He did
Okay.
Clinton imitation.
Yeah,
Imitations,
He was
yeah.
great. Yeah, he was diagnosed during childhood.
Oh my goodness.
supposedly.
Childhood.
That's
That's what
kind
it
of
said.
early, yeah.
What the heck? Okay.
Yep. Tom Harrell. He was diagnosed in his 20s. He's a composer and a jazz musician.
Okay, are we looking at creatives?
Creative people, right?
Yeah.
Which is part of what I think a list like this does, or helping us to understand, you are not alone, as with most things in mental health. You feel like you're alone, but you're not alone. And the reality of it is as this gets managed, and we'll talk a little bit more in a moment about, what do we do to treat this and whatever, but you can live like this. This is not a life ender reality in the way that you can operate. You can be very creative, highly successful, and gauge life and excel in some ways that maybe otherwise you wouldn't, honestly.
All right. We'll kind of go through this a little bit. So, let's see. John Hinckley Jr.
Yeah. Now that's not on the wonderful
Yeah.
side.
Uh-oh.
But
Who's
because
he?
there's some violence, and in fact, sometimes there's where the paranoia becomes or the delusion.
You had said that early on with the
Yeah.
paranoia.
Right, that it can manifest itself, and in fact, there was one of the professors at Texas A&M in Corpus Christi. Her husband was killed by their son because
Wow.
his schizophrenia was untreated. There was some drug use and self-medication that was involved. And
Untreated, may not have known this was kind of going on, and again, I suspect it's
kind
just
of
a self-
resisted, didn't accept his
didn't
his-
accept it,
his
didn't
condition.
understand it, and it's self-preservation. Like, I
Yeah.
am going to protect myself
Yeah.
from the things that are attacking me, which in this instance, I'm believing because my delusional state is you.
Mhm. Yeah, and you're
do
a
you-
threat. I mean, it's a threat.
You're right.
Yeah.
Do you know who that is?
No, what? Who?
John Hinckley Jr.
Oh, I do not.
He tried to assassinate Reagan.
Oh, really?
Yeah,
That's
and,
the
and
shooter?
actually because of him, he was basically diagnosed with schizoid personality disorder, which to you might mean
It's-
something. But he was,
No.
they changed a lot of the
Definitions.
legal stuff because of him, and insanity pleas and stuff like that because of him. And those
Oh,
lawyers,
really?
They,
Yeah.
they
Now
did some
he's
stuff
out
back
on
then.
parole now, I think.
Is he?
Finally, yeah.
Yeah,
But-
it looks like he is back in 2016. It looks like. So
That's when he first started having the parole, but he's now, I think he's living at his mother's right now.
So I'm gonna just kind of go through these people and kind of just see if anyone
Yeah,
stands out
hit
to
through
you.
him pretty quickly.
So Jack Kerouac,
Yes, author.
yep,
Yeah,
author.
very fit.
He was diagnosed at 21.
It's 50s on the road, I think was.
Yep,
Yeah.
that's exactly right. Veronica Lake.
Was an actress in 1940s.
Yep,
Yeah.
yep. She was diagnosed during childhood. Mary Todd Lincoln.
Is Abraham Lincoln's wife, and
Yep.
she was different.
Not officially diagnosed, but they think they speculate that she had it.
That's right. She was into seances and spiritualism.
Lincoln?
Lincoln's
Wife.
wife,
Lincoln's wife?
Mary Todd.
Holy crap!
yes.
Really?
Yeah.
Dang.
Rufus May. He was diagnosed at age 18, and he is a clinical psychologist.
I saw that.
Oh, okay.
Yeah.
I wonder if he's
yeah,
related to Rollo May.
Keep going though. Get through
Go
this
ahead.
quickly.
I'm sorry.
it's all right.
John Nash. You guys should
Yes.
know
That's where we
him.
Yes,
wanted to
sir.
bounce back to,
Yep.
and I'll end this one with him.
Okay, then there's a bunch more. Ingo Svichtenberg, a drummer for some band. Skip Spence, another songwriter. Jean Tierney,
Was an actress,
Actress.
1930s and 40s.
Van Gogh, probably one of the most
That's
famous
right.
artists. You know,
Wow.
he had a lot of
Schizophrenia. huh?
Yeah.
Yeah, but he also there's a lot of stuff with him that was very interesting. But Wesley Willis, who was a songwriter back, he was diagnosed at the age of 26. Brian Wilson was one that I thought was
That's right.
interesting.
He lay in bed for like a year or two, just because of dealing with this.
Did he really? That's
Yeah.
crazy. But yeah, he was 30 and he got diagnosed in his 30s. So yeah,
he
so
dropped out.
interesting, very interesting. But yeah, so John Nash is I think the way you want to go next.
Yeah, it's listen, a really good. Thanks for your help, Neil. The really good way to get a good sense of what it is that we're talking about here is the movie A Beautiful Mind. I say that because it's been a while since I watched it, but I did this show on schizophrenia a few years ago, and I remember rewatching it for that show to remind myself what that show really did. And I tell you, you will enjoy the movie just because it's a good movie. And if you didn't know it was about schizophrenia, you'd be surprised that it was even about schizophrenia. And it's a true story. This guy John Nash got highlighted, and you will see. I don't want to talk too much about it because I want people to watch it to get a good mental health understanding in a realistic way. What happens for this kid who's living a normal life and begins to graduate with a really high level academic reality? I think it was from Harvard, and he just became psychotic. Go ahead.
No, I think his hallucinations are depicted as visual primarily in the movie,
Right.
but they were auditory for the most part. But the paranoia was there.
Oh, really? His real story was
real
more
story.
auditory than visual?
Yeah.
Oh, okay.
But
Interesting. I didn't know
the
that.
paranoia was more was certainly there.
More pronounced.
And the sense of the spies and.
Well, I guess it's hard to depict auditory hallucination.
That's what
on
the director
on the
said.
videos.
Yeah.
So that makes sense that they did that.
So
way.
that was the license on that one. But other
Check
than
it
that,
out
it's-
because it was a really good way
spot
to
on.
understand what it is that we're talking
Yeah.
about. We've got a good YouTube question as well about does illicit drugs cause this? So when we're talking about diagnosing this, figuring this out, I want to be a very clear, resounding no. No. We don't know really of any connection as far as I'm aware of that using heroin or psychedelics or any of this type of thing.
But when
would
do
create-
people do this for the most part? It's when they're young.
Right.
And so it could manifest during this time. It may just be correlation is not necessary. What is it that they say?
Correct. The
Here's a-
the correlation to causation is
Causation,
not
yeah.
there.
Not there.
Like there's not a correlation here with drug use in initiating an onset of schizophrenic experience. And I think that's a true statement. Hold me to it because I think it's a true statement.
Do you see an increase in drug use because of possible?
That's the
That's-
thing. It's the opposite way. Exactly, Neil. That's where I'm going to. There's a belief that there may be a causation correlation because I think what happens is people start to experience this. They start to freak out. And you're already old enough, probably experimenting with weed or alcohol in some regard. And then you start using to cope, and boy, then you've got more of a problem.
This is going to your point that you think it's more common than
I
it
wonder,
was
yeah.
because
I do.
you're thinking that people because a lot of the people that I see have really struggled with illicit drug uses or overuse and abuse. And I'm wondering if there's a sense that maybe something's going on inside of their mind
Yeah, John.
because it's a beautiful mind,
Right.
and they're feeling like they're losing their ability to,
Right.
or their control.
And I can see where people would just cash out,
Yeah,
check out, cash out,
yeah,
drug out, and now you've got a compounded issue because drugs are not going to help this condition.
No.
That's for sure. Regular and illicit drug use, and then you've also got what is this like, and what is this like for families to deal with? Well, there's a lot of non-compliant treatment. There's a lot of like, I am fine. There's nothing wrong with me. A huge system of denial begins to take
You
hold.
think the unhoused people, a lot of unhoused people are having to struggle with this.
Homeless, you mean?
Yeah, homeless, yeah.
folks.
Yeah, I'm using a term of art now, I guess. How
Let me think about that for a second. Go further with that because I'm doubtful. Actually, I'll just tell you my immediate response is I'm not an expert on the homeless population, but I almost feel like trauma is a way bigger thing with the homeless population than
Okay.
schizophrenia. I do.
Yeah.
Trauma that rather than bipolar or damaging things to our mental health like schizoaffective or schizophrenia, I really feel like.
So you think people
trauma's
that
big.
maybe are self-medicating that maybe that have had trauma?
Yes.
Okay.
What say you?
I'm kind of thinking that people that are struggling in their lives and they become paranoid or develop delusions or something will self-isolate
Okay.
a lot of times
And
or-
voluntarily just enter into the homeless population.
Yeah.
Okay.
Kind of drop out.
Well, you're probably right. I'd be curious to see, kind of if there's been people that have tracked that, studied that, and checked out like 1.5% of our population, at least in the States, that's schizophrenia. And I don't think that's probably too different around the world.
No, I think
really.
I think if it truly is some sort of a genetic or organic basis, I
Yeah.
think it would probably be pretty evenly distributed.
I think it is. Yeah, I can't say that I've looked that up and stuff for this show, but I think that it is. And thus you'd see the same thing in populations around the world with homelessness.
yeah.
Propagating out that way to that manifested outcome. But
Now the cultures may deal with it differently.
I'm sure.
Right.
Yeah,
So-
I'm sure. So that's a good transition. How do we deal with this, John? What do we do with treatment? What do we do with these folks?
Well, one is I think is to treat them as wonderful people and just people that are having some certainly like a medical issue or psychological issues that they would not be ostracized, that they would not be mistreated in the prison system, for example, the legal system,
Right.
because they get caught up in that.
Right? It's horrible.
Yeah.
They some people that are insightful, and it's true when you hear that statement.
Give them
oftentimes
respect.
Our prison systems are wrapped up with addicts and mental health patients. In a lot of regards.
Yeah.
I want to
It's
maybe
not. It's certainly
advocate.
not penitentiary. It's not a penitentiary kind of thing.
It's not a good treatment facility. That's for
Not
sure.
a good treatment facility.
You know, and I want to do a little advocation here because, you know, when you look at how are families managing this and how do we treat this, like, you know, we've had a whole different progression, at least in the States, and I think around the world, much similar, of what we did. What we used to do is just put these people away.
Yeah.
We had the traditional insane asylums.
Uh-huh.
And if you had schizophrenia or something like this that we just didn't know how to manage, how to control, we slapped your butt up into an insane asylum. And we had them all across the nation. In North Carolina, I believe that was Butner, North Carolina, up there at Butner.
Yeah.
Right? We had good old Weston Hospital, Weston
Broughton.
State Facility in West Virginia.
Yeah.
And Broughton,
Yeah.
was that?
That's in.
Lenore Hickory. My
Yeah.
wife's dad worked there for a while.
Yeah.
Yeah. Where Neil's telling us it's in Lenore Hickory in North Carolina. But
Morganton.
these were bad places, John.
Yeah.
These were rough places, scary places. You didn't want to work there. You would get regularly assaulted. Like people died and were killed in insane asylums. And then that was our treatment. You know, I suspect we
Well,
did
they
like
used to
lobotomies
wrap-
and things like that.
Right. Well, that goes right into through the
Right? Just
right
drilling
right
holes.
between the eyes. Yeah.
We got better
literally.
and figured out some antipsychotic medications. Look at One Flew Over the Cuckoo's Nest, and that gives you some advancement.
ECT, for
ECT.
example. But I'm also wrapping people in wet blankets, cold wet blankets, trying to do that kind of shock treatment.
Right.
That was more 19th
And honestly,
century.
it probably helped with brain inflammation.
Yeah.
We didn't know it.
Yeah.
And lobotomies probably
Yeah.
helped with tumors, you know, with sometimes successful treatments. We didn't know we were
But you
breaking
get
up a tumor.
through the orbit of the eye. I mean,
Right.
it's just
But then we got better, and we figured out, let's close these bad places, and we'll do community mental health systems. And we helped people that were struggling with this get onto medication, which is very important, psychotropic medication, antipsychotic medications, and then had case management that tracked you, followed you. We supported people living at home. We supported people living in the community. And that worked well when I started my career in the 80s and 90s.
but it's kind of
And now, what has happened, John?
we're in managed care to a certain extent, and the
gone
funding
away.
has gone away. Yeah.
Now we don't really give them very much services, and we don't really treat them. And so it's very much only
We
acute
dehumanize
care.
them. We dehumanize them.
But we give acute care.
Uh-huh.
If you're a danger to yourself or others, we put you in a hospital and we keep you there for a month or two or three, you know, maybe several months long off, you know, for long-term care for people that are really, really sick. But then we discharge them and send them back home. And so families struggle tremendously. And again, this is much more common than you would think. So many, many, many millions of people across our nation and many, many millions across the world, on top of that, struggle with, how do I manage my Aunt Mary? How do I manage my brother, in the case of my client this morning, throughout the course of their life as a family member? And it's tough. So we need better answers than what we've come up with, is what I guess I would lead us to think about.
I feel humbled by this because I don't sense that I'm at all prepared to. Because I think we don't know enough right now. We don't know enough effective therapies, psychotropic interventions.
Yeah?
Yeah.
What do you mean?
Well, I just think that there's so much we still have to learn about it. So,
True, but I think we know some to treat now to some
least
some extent.
But there's some serious side effects to the medications. There's people.
Okay. True that.
Yeah.
Go on.
That sometimes people feel. Hopefully, the medications have improved, but a lot of times people feel like they're not as quick in thinking, and that they're in a chemical straitjacket. And I think that's, and yet they would choose to be medicated because they want to be able to be productive. More productive.
So I feel your pushback, and I get that. I think you're right. I definitely see that. I mean, we have about all of mental health a lot more to learn. I think that of all the medical conditions and all the medical realities, mental health is one that we know of, the least about.
Yeah.
But I think that we do have treatments out there, and these medications that we have available do work. They do stabilize the functions of the brain to avoid, reality testing problems.
And there is evidence-based efficacy for CBT, REBT, talk therapy.
And that's where I would go in that, obviously the talk therapist is going to kind of land there, I guess, to some extent. But, I just want to simplify it a little bit, John. I think if we took the mystery away from this and we helped people, as I was able to help that teenager to relax and calm down about what this really means, so we take the fear out of what it doesn't mean for your life when you're struggling with this.
Demyth it.
Demyth it.
Demythologize it.
Demythologize it. There you go.
Yeah, that's what we learned at seminary.
Help us understand the basics of what this is. Because the fear drives us, I think, way more than the disorder itself. Mm-hmm. The shame drives us way more than the disorder themselves. When we're talking about psychiatric diagnoses that are significant like this, I think they find themselves bigger than what they need to be in the life of a person. So where if we can find some acceptance, it is a much better prognosis.
Right, exactly. And some folks are so creative, they give to society in wonderful, wonderful ways.
We just had an amazing list, amazing list of people that you wouldn't have thought.
Music, literature, science, economic theory, just all of this. Painters, just enriching life. And so in a sense, perhaps some of the things that they are seeing and experiencing in their own lives, they're able to express, and they enrich our lives.
I think so.
Yeah.
These are a part. These are people that are a part of us. Yeah. It's a pretty debilitating condition, but they're a part of our community. And I think that when we take the mystery out of us experiencing the person as much as the person experiencing themselves, I wonder what we would be able to accomplish with their prognosis and their healing. Mm-hmm. I don't think it has to be as big of a deal as people really believe it to be. John Nash, even without medication, medications is only one choice, only one option to help us manage mental health. It's not the solution.
He won the Nobel Prize.
Yes.
Yeah.
Did amazing things in math. And computing or whatever that
computing and theory and just
amazing stuff. Amazing stuff. So I feel like I'm getting on a high horse. I'll calm myself down, but because these folks get demonized, I think, and really kind of marginalized in as you were saying, John, we just don't accept them.
Right.
And they're struggling people that we need to get over that and accept them. Now, I will say this as well. If you know anybody in your family or yourself as you're managing and coming across this, let me make a marking bold statement here. If you combine significant mental health disorders like schizophrenia or bipolar and schizoaffective disorder, to name a few, with substance abuse, addiction, drug, alcohol, weed, you have a bad prognosis. Mm-hmm. That is not going to go well for you. Mm-hmm. What we really need to be able to manage is sobriety, so that you're not coping with the struggles that you have while you're managing this issue. In addition, that's a bad combination. Don't do that. Fair statement?
Fair statement.
Right. Schizophrenia, we used to call it dual diagnosis. Remember the days of dual diagnosis? Man, they were some of the most strugglingest people. I mean, significant manic behavior and addiction issues, significant reality testing, and illicit drug use. I mean, it's just they were not functioning well.
I agree.
and didn't recover very well. It made things worse for them. So I will say that pretty good thing. I don't know, John. Any other thoughts, comments? I think we're winding down. Understanding schizophrenia, understanding a significant mental health condition, what to do with it, how to manage it. We haven't done a diagnostic show.
No,
Diagnostic
it was
show.
fun.
Yeah.
I enjoyed it, but again, we're learning so much more day by day, and so hopefully and prayerfully we'll be able to have people that may not have to struggle
as much.
Yeah.
You know, I can tell you, it's been an honor to work with people in therapy. I talk about that a lot because it really is, and
They're heroes.
they really are amazing people,
Yeah.
and the people that I've been able to work with this in a successful psychodynamic outpatient just talk therapy practice, man. I mean, it's you can do that. You can do that. I think clinicians even in our own field get a little fearful or tripped out about this. Like, what am I supposed to do with that? How am I supposed to deal with this? It's like, just talk to people.
They're people.
They're people.
Yeah.
That's all. And they're scared.
Yeah.
And we need to calm them down and figure out how to manage the moment. Right?
Yeah. For them to live in the moment and be in the moment.
And be well.
And be well.
Right. So I hope this has been helpful. Comments, thoughts, contact us at throughatherapisteyes.com. This is not mysterious. We want to, how's the word, John? Demythologize schizophrenia. Hopefully
schizophrenia.
we've accomplished
so
that.
take the otherness of it away and just make it into something that is part of our lives
as a community.
As a community.
Okay, good deal. Guys, stay well, take care, and we will see you soon next week.